salmon, krill oil, very rich in astaxanthin. But one of the things it does for the krill, apparently, is they swim around pretty close to the ocean surface a lot of times, and they get burned by the sun. It would literally burn them up. And the astaxanthin, I've read, is what protects them. Well, we went whale watching about 10 years ago, and I was doing a lot of krill oil at that time and a lot of vitamin D. So we're out doing whale watching out of Moss Landing out in Monterey Bay, and it's really sunny. And my wife comes up to me about an hour into our trip and said, "Do you have sunscreen on? Because you can see my skin. It takes about 5 minutes for me to burn to a crisp." And it was about an hour into the trip. I said, "Oh my God, no, I don't." But you know what? I'm not even pink. I wasn't even pink. And I didn't get a sunburn. That's the only time in my life I've ever been out in the sun for a long period of time. And I got to tell you, I blame that on the astaxanthin and the high vitamin D levels. Hi, and welcome to The Balancing Point. I'm Dr. John Nieters, and I'm here to make traditional Chinese medicine, functional medicine, and integrative health simple, practical, and fun so you can restore balance, boost vitality, and enjoy a healthier life every single day. Hey, y'all. Thanks for joining me here today. This is a really fun show I'm thinking that's going to happen. And I'm here as your host of The Balancing Point. This is John Nieters. And today I've got a really special guest, very special to me, and I think special to you. His name's Dave Stouder. I've known Dave for many years. And he used to own a store in Redwood City called Apple Health. And I remember one of the things, in fact, I actually went online and looked it up and see if there was still anything there about Apple Health Foods. And there still is on Google. And I was reminded that his real phrase that he went by is, he called it Mother Nature's medicine chest. And he really lived by that. And Dave's customer service at that store, my patients miss him so much. That store's been closed for over a decade, and I still have patients coming in and asking about Dave. Now, what's significant in my mind about Dave, as well as being a great person, is that he has experience in the manufacturing side of supplements. He has experience on the wholesale side of supplements, and he has a lot of experience on the retail side of supplements. So he probably knows as much about supplements in general as anybody around. So I love picking Dave's brain. We used to have a lot of fun at one time. We were both on radio, and we decided to do a radio show together called The Medicine Men. And it was a gas. We would have nothing prepared, but we'd show up, and Dave did most of the interviewing. He's a very good interviewer. And he'd say, "All right, John, let's talk about this." And I go, "Okay, Dave." And we just rap for an hour. And it was so much fun being non-scripted, unscripted, and just going through things. And so Dave really, really focuses on the natural way of healing, the way people have taken care of themselves for centuries, lifestyle, diet, getting enough sun, being social, actually,
Right.
and keeping your mental health, all the things that people have done for centuries. We look at these areas they call the blue zones now, where people live to a riper, older age than people in other areas. And it's really the stuff that Dave's going to talk about today. So Dave, how you doing?
I'm doing great. Came back out to California and was able to come visit you more than once a year. It was just really great. And I think back to our radio show, The Medicine Man. And really, folks, I can remember the old days, like I would call into the radio station and John would call into the radio station. So we wouldn't be in the same room most of the time. And I can remember, we'd be on hold waiting for the show to start. And I go, "John, I got some good questions for you today." He'd go, "Okay." And that was it. And John and I, John's very credentialed. I've gone in as a patient. My wife has, my daughter has. I really never met anybody like John because he's humble, but he usually knows something almost about everything, at least a little something, if not a lot. And, I don't have credentials, but as John said, I've been in the industry for about 53 years. And if you're in a health food store and all these places and you pay attention, you learn things. And I got to work with people like John and some of the luminaries in the health food business. And I would say we are confusing being medicated with being healthy. I think that's a real issue. Medications have their place, but health comes from diet, lifestyle, and nutrition. And we have these wonderful interventions that can save our life and do amazing things. But if we would really understand that, they say alternative medicine, we're not the alternative, okay? We are the way to health. This natural foods industry, John, to me is the only industry that actually talks about health. We don't talk about insurance and
Yep.
medications and disease management. We do talk about Mother Nature's medicine chest, exercise, real food. And I think we just need to really attempt to rely on that more, because if we don't, then we just think like, well, I have a headache, I'll just take Advil. It's a sort of a slippery slope. And when I would hear John lecture, and we have good people out there. We have good people in health food stores. We have good practitioners. We have guides to help us. So if we could just remember that 80% of our health is diet, lifestyle, nutrition. And we're going to talk about a few supplements today. And I just want to say to everybody, I don't think that supplements are a substitute for a good diet, but I also don't think a good diet is a substitute for supplements. I think we live in a world where most of us aren't angels with our lifestyle. We do things that we know aren't so good for us, but okay, we live in the real world. But even if you're a saint, you live with what, 30, 40,000 liver toxins, John? And so you are
Yeah,
being
something like
beat,
that.
you are being beaten up. And so to me, I don't think you can make that up completely as you age, especially just with diet. And so avail yourself of Mother Nature's medicine chest.
You know, I have several studies that I'd collected over the years that were done on the cord blood of infants, right? These are babies that had never been out in the world. It was the blood that they were having circulated while they were in utero, and over 99% of the children, the cord blood that was tested had over 200 toxins. So they were born with those toxins, and then we're just going to add more. And I had a kid, he's kind of cocky in one of my nutrition classes when I was teaching. He was in acupuncture school, and I taught combination of Western and Chinese nutrition. And I was talking about supplements and herbs. He said, well, why would we need that stuff? My grandparents didn't need it. And I said, well, that's because your grandparents were eating food that was grown in soil that still had some nutrients in it. And I pointed to a study that was done in the 1930s where they said 70% of the land that we're growing crops on had no nutrients in it. So if it's not in the soil, it's not going in the plants. But then I said, your parents weren't eating the type of wheat that you're eating. They were eating a much higher quality form of wheat. And when they had dairy, it was raw, straight from the cow dairy with all the nutrients in it. It hadn't been homogenized and pasteurized. So good luck finding all of the things you need without an occasional or even more than occasional supplement. So
And
anyway, thanks.
I'll expand on that just a little bit. You know, I can remember Johnny Carson, for those of you that, he was like the main late night talk show host at the time. But anyway, he was talking to somebody. He goes like, well, a carrot's a carrot. What's the difference between an organic carrot and regular carrot? Well, A through zinc, maybe not a lot. Okay. They are very similar. But then you get into phytonutrients. And when you use pesticides and things, you destroy most of them. And the phytonutrients just play a big role in health and detox. But we can go deeper. There's supposed to be a microbial life in the soil, almost like the microbiome of the soil. And that should be part of the plant. And that then should be part of the health benefit from the plant. So even if it's organic and not full of a bunch of toxins, it may not be in great soil. And so, as John said, generally, we all come into the world starting with more toxins than our parents. And the environment we're growing up in has more toxins than our parents. So, yeah, I know older people, smoke cigars, drank alcohol, they're 95, they're fine. but you won't find as many of those today. And now we have, 6-year-olds with anxiety and GERD and all kinds of things. So, folks, avail yourself of Mother Nature's medicine chest. I thought, I know there's a lot of you out there that are maybe supplement aficionados like me. Like I don't mind taking a lot of supplements, and I had a store, so you could take a whole bunch. But I know there's a lot of you that would like to really try to get most of it with your diet, and I admire that. But I want to talk about 3 supplements that I think everybody should do. I don't care how healthy you are or not. I think, when you pick 3 out of a 1,000 really good things, you're going to leave good things behind. But if it were me, I would not do less than the 3 things we're going to talk about today. And
Great. That sounds fabulous.
okay, maybe
Roll them.
top of the list, John, you mentioned being out in the sun. And the sun actually does a lot for
Mhm.
you. But one of the main things is vitamin D3. Now, I want you all to picture something. If you think about it, all the energy on the planet comes from the sun. The different lights we see, and in a sense, the electricity, everything really generates from the sun. And I think of vitamin D that way. The sun hits your skin, you make vitamin D, and that compound becomes so many things, just like the sun gives so many forms of energy. And D, we think of it as bone health, and that's true. One of the sort of major pathways of D is to help the bones. And it may be that 4 or 5,000 D a day may be enough for bones for a lot of people. But there's different pathways. D makes hundreds of hormonal chemicals. John, I was talking to Dr. Michael Murray. Many of you know him. He's pretty well known in the industry.
Oh, yeah.
And he told me something I didn't know, that vitamin D helps prevent fatty liver. So people say, like, what does vitamin D do for you? And I'm almost like, well, it'd be easier to just tell you what it doesn't. So, it does help your bones. It does help your heart muscle. Along with vitamin K2, it helps keep calcium out of your arteries and soft tissue and into your bones. It's critical for the immune system, for autoimmunity, for thyroid health, even for vision. And so we have underestimated what we need. I just want to read one paragraph. I'm going to tell everybody that from my point of view as somebody in the supplement business, I don't know why anybody wouldn't take at least 5 to 10,000 a day. John, you're welcome to chime in on this, but Dr. Reinhold Vieth is one of the leading D3 researchers in the world. He's a PhD toxicologist. He's worked for the CDC, and he just says here in this study, he goes, we present a risk assessment based on relevant, well-designed human clinical trials of vitamin D. Collectively, the absence of toxicity in trials conducted in healthy adults that use vitamin D dose over 10,000 units supports this confident selection. The value is the upper limit. So if you lived on the equator, you'd probably pull in about 30 to 80,000 a day. So folks, don't doctors are still a little slow, most of them, on this, and they want to stop your blood level at 40 or 50. The people studying it want you to be 100 or a little more. So I used to take quite a bit. My levels were 206.8, and I'm still here to be on the balancing point. So because D does so much, it's one thing, it's not expensive, it does so much. I would make sure you're getting D and get more than is in your multi. And I
Great
nope,
point.
I open the floor to your comments, John.
Yeah, the one caveat is if I find someone that has so vitamin D, one of the reasons it's not much of a problem at any level, I mean any level over 60, is that it still has one more conversion to become the most active form, which is called calcitriol. So what's being tested when you get a D3 test is 25 hydroxy vitamin D. That then converts to 1 comma 25 dihydroxy vitamin D, and that's what actually gets locked into your receptor sites. And in a few people, and some people with a kidney disease have to be a little careful. If they come in and they've got really, really low vitamin D, it's like 10, 15, doesn't, or if they're taking vitamin D and it's still low, then I will run a calcitriol test just to make sure they're not over converting to that form. But we're looking at less than 1% of the population. Would I even be concerned about that? But one thing I want to mention And it's something I could not legally say during the pandemic because California passed a law that people in my position, even MDs, could not say anything other than what the CDC told them to say. Well, I'm looking at studies from all over the world, and one of them that was done at the Galilee Medical Center in Israel showed, and they put vitamin D users in quintiles, five different levels, and the people that were in the lowest quintile died from COVID at 14 times the rate as
Yes.
the people in the highest quintile. 14 times higher death rate. All they had to do was take a few pennies worth of vitamin D a day.
Yeah.
So,
Not
anyway, that's my 2
14%
cents worth.
people, 14 times, 1,400%.
Right.
It's
Yeah.
so, and that's the thing. It does so much for you. And you say, "Oh, I go out in the sun a lot." Well, if you live in Florida or, Brazil, okay. But the farther you are from the equator, the less D you make, even if you're in the sun. So I encourage you to go out in the sun. I'm not saying don't go out in the sun, but take your vitamin D. Now, the next thing, John, everybody talks a lot about inflammation, and they should be. I remember there was a big, I think Time, it was either Time or Newsweek when they were a real magazine, had a big article on inflammation and health. And the sentence that I really took from it was, inflammation is the engine that drives every chronic disease. Now, one of the main reasons we would have that chronic inflammation, and almost think of it as a pilot light that can just light fires all over your body if you're not careful, is the imbalance between omega-3 fatty acids and omega-6 fatty acids. I've seen studies where even if you don't eat junk food, let's say you eat really good food, still, if we lived out in the wild, our omega-3, omega-6 would be roughly equal. Maybe omega-6 would be 2 or 3 times as much. Typical Americans are 20 to 30 times the omega-6 to omega-3. And whether it's junk food or real food, that is a equation for inflammation. The easiest thing to do is up the omega-3. Now, here's where we get a little complicated. I'm a big fan of fish oil because the fish have converted the omega-3 into the active forms. I won't mispronounce the long names, but they're EPA and DHA. And there's plenty of studies on fish oil, and you go to a health food store, you can get clean fish oil because fish oil being rancid or contaminated is certainly an issue. But I wanted to point out to you very strict vegans who are listening to me and going, I'm not doing the fish. I get it. Now, you have one alternative. The thing is, eh, as we referenced before, we live in a liver toxic world. Just people are not converting your flax and your hemp and your walnuts. They're just not converting the ALA into EPA and DHA at a very small rate. And when I meet someone who's a strict vegan, the first thing that comes to my mind, like what their health issue might be, is fatty acids, because even at best, we're not converting them very well. So many of the companies make an algae oil that has been converted to EPA and DHA, and that's one good alternative. A little expensive compared to fish oil, but it has been altered. But I want to give a shout out to a really emerging fatty acid, and that is black seed oil. And I was thinking about this. Black seed oil is pretty amazing. John, I don't know if I told you this, but okay, I'm sure you tell your patients to eat a colorful diet, right? That's healthy.
Yes. In
Now,
fact, Chinese medicine is based on seasonal eating by color.
okay, now to everybody out there, when I said eat a colorful diet, what did you see? You saw green and red and yellow and orange, okay, maybe purple. So when I was a little kid in elementary school, I was fascinated by mixing colors when they taught us paint. You could put like yellow paint and blue paint together and it made green. Like that just fascinated me. I remember them telling me that the absence of color was white and that all the colors mixed together were black. Now, when I said eat a colorful diet, nobody saw black. Probably not. I don't think you did. I don't. But black is all the colors. And I would tell you that black seed oil, I think, really should be more significant than turmeric. as the herb that has such a broad. And in the fatty acid profile, black seed oil, it also has some things that help the liver convert. So generally, I would recommend everybody do a good omega-3, a good fish oil if you're not a vegan. But if you are a vegan, I would add black seed oil. Did you tell me, John, that was in, I think it's in the Quran, that they say black seed oil cures everything but death?
Well, it was Avicenna, the great Persian physician. I mean,
Okay.
this guy was brilliant. About 1,000 years ago, he's reputed to be the first doctor to do an appendectomy, but he was brilliant. He was revered, and he said, "The one thing I cannot be without is black seed oil or black seed." And he said, "I can cure anything but death if I have black seed." He said, "If they're already dead, I can't do anything, but
Yeah.
everything else we can heal with black seed."
Well, most of us, when we're dead, we don't go into health food stores. Now,
Gotcha.
I do want to give a shout out, and you and I have talked about this, to one of the companies when it comes to black seed oil. There are a lot of good products on the shelf. Now, the main active ingredient is called thymoquinone, kind of like we think of curcumin with turmeric. And usually, if we're buying a turmeric supplement, typically we want to see how much curcumin is in it. A lot of black seed oils don't even state the thymoquinone. That doesn't mean they're bad, but I don't know how to compare them, right? Like this one, and so there's one by a company called Health Aid America, and it's around here in California certainly, but you can find it on the internet too. But they make a black seed oil from India, and the soil in India really is superior, measurably, I think, than Turkey or Egypt, where a lot of it comes from. And they it's organic. They hand pick it, they hand press it, and I've tasted black seed oil. I wouldn't say it's tasty, but this has actually a good taste, like a sweet, rich olive oil with a little bite, and it has a minimum of 150 thymoquinone in 1 teaspoon, and the ones that do state are usually 40 to 50. So this to me is the superior
Yeah.
black seed oil. And by the way, John, there's a lot of things, we could probably do a whole show on black seed oil, but I noticed that there were studies on glaucoma on black seed oil, and that's something you really need to go to a practitioner about, because I don't see much on the health food store shelves for that. And the other thing, I was at a trade show and was speaking with a woman who turned out to be a thyroid practitioner. And we were standing at the health aid booth, and she put her finger on top of the black seed oil, goes, "Number one thing for thyroid." I'm like, "Really?" And she goes, "Especially Hashimoto's." And when I looked at PubMed.gov, there was a study where 2 months, I didn't read how much, but 2 months on black seed oil cut the elevated antibodies, the TPO and the TGO, in half. So this is a really good whole food oil. It's not spiked, by the way. Just you think of it like avocado oil, coconut oil. And so I'm a big fish oil advocate, omega-3. I think we need preformed EPA, DHA, and I would be curious about your thoughts. But adding black seed oil to that, I think, is a really great idea.
You know, Dave, you are the person that turned me on to using it for Hashimoto's, and I'm seeing the same type of effect. I have quite a few patients, because I treat a lot of Hashimoto's, who are getting really great results. Where I had used black seed oil for decades was for ulcerative colitis. I remember this one guy came in, he was desperate. He said, "Look, they're gonna take out my large intestine next month. You gotta help me." So I did everything that I knew to do at that time, and he went into remission enough that they let him keep his colon. But he was like 90% better, but there was like that last 10% we couldn't get, and then I started giving him black seed oil, and that was the final magic ingredient. And one of the years ago, again, I don't know how many, couple decades probably, I was looking for supplements that could help people with pancreatic problems. And the only supplement that was ever listed in any of the studies was black seed oil. So it has just a myriad of uses.
Yeah. My little image of all the colors are black, and you need a colorful diet. And so I would say I love turmeric, and I like it that people are putting turmeric in their food and cooking with turmeric and making turmeric drinks and turmeric milk. But I would say that black seed oil deserves to be a tier above even turmeric. So as we talk about fatty acids, to me, you got to get your omega-3 because almost all of us need more omega-3 to balance out that omega-6, omega-3 relationship, which if it isn't balanced, it drives inflammation. Now, so we've talked about two things, vitamin D and fish oil with a little side note there about black seed oil. Now, the third thing, and maybe this should have been the first thing, is to take care of your microbiome. And I want to make a little distinction between probiotics and microbiome. Probiotics are supplements that play a role in the health of the microbiome. And I'm going to go out broad with this. I remember when they mapped the human genome, okay, that the interesting thing was they found like, this many genes, but this much activity. It was activity they couldn't account for in what they had mapped. And then they realized at some point that that was the microbiome, that, your bacteria do have your DNA. And this activity was that colony. And by the way, folks, if I'm looking at John and he's a trillion cells, there's like probably 100 trillion bacteria we're looking at that we don't see. And they're not like ants you're supposed to brush off your sleeve. They're a functioning colony. And now mRNA, we kind of think about that as the technology in the COVID shot. But mRNA is the messenger that tells your DNA what to do. Now, one of the reasons why as we age, we get more conditions, diseases, not the only, but one of them is that we lose our genetic stability. We can't keep our good genes turned on and our bad genes turned off. So the mRNA is what tells your DNA what to do for the most part. That's epigenetics. We're learning now that your fate is not in your DNA as much as we used to think. Your inner and outer environment conspires to tell your genes to do the right thing or the wrong thing. And a good a good 80% of that mRNA message comes from your microbiome. Now let that sink in a minute because, we all know the gut issues, oh, I've got reflux, I'm constipated, I get nauseous. Okay. And we go, well, one of the things you need to do is your microbiome, but there's plenty of things going on in your body. Some of them take decades to manifest. And if you're not tending that garden, if you're not keeping that up, then you're heading towards some kind of problem. And don't rely just on your gut to tell you. And that's like one of the first places to go. I was attending a lecture by this guy named Dr. John Nieders one time, and he was talking about certain medications. I raised my hand and I said, so John, we know that antibiotics and hormones are particularly rough on the microbiome. What other medication should we be concerned about? And he said, all of them. So every medication, sort of inhibits your microbiome. And what I say to people is, why do they put chlorine in water? Kill bacteria. So if you drink tap water or anything made with tap water, when you eat sweets or sugars, even a glass of orange juice, whatever the sugar is, it disproportionately feeds negative bacteria. So I'm sorry, folks. No, to me, no one's walking around with a truly healthy microbiome unless you're doing something about it. Now, John, you and I have been talking about this issue. There's a product out there, everybody, and I got to give it the Olympic gold medal as a microbiome supplement. And by the way, probably everybody on the track team in the Olympics can run faster than I can and John. But there is a gold medal and a silver and a bronze. And I'll tell you why I think this is the gold medal. You go into a health food store and you got a lot of products, right? And if you were asking somebody who knew about all the products, why is this one good? Why is this one good? They'll all tell you, well, this is what we did to make sure the bacteria could actually get through digestion, because that's tough. When you put bacteria in your mouth, to really get it through the digestive system, they have to have certain strains and they might enteric coat it, and that's good. And then when it gets down there, it has to actually be able to implant and get work with all the friends in there. And so they'll pick strains that they feel implant best. Okay, that's good. And then it needs food. And we may not be feeding it well ourselves. So they put, prebiotics typically into supplements. But here's the thing we don't realize. So, John, if I asked you, what do probiotic bacteria do for you? You'd give me a bunch of things. It helps with constipation, helps absorb certain nutrients, helps with mood, helps with immunity. And to sort of make a point, I'm going to say, no, John, the probiotic bacteria don't do any of that. And then as everyone's saying, well, what do they do? If they get down there and if they implant and if they're fed, they make a whole set of compounds called postbiotic metabolites. Now, when you eat a fermented food, like, sauerkraut, whatever, there's bacteria in it, but there's also postbiotic metabolites. Now, some researchers say that, fermented foods are better for you than probiotic supplements. I'm not so sure about that. But to me, the kernel of truth in that statement is that complexity of a fermented food that has postbiotic metabolites versus a really strong collection of bacteria. Okay. Now, because of that, there's a product out there called Dr. Ohhira's probiotic, and that's Ohhira, like a Japanese name, not O'Hara. And happy St. Patrick's Day to everybody. Because we're recording it on St. Patrick's Day, so I'll mention that as a guy that loves finding clovers, 4-leaf clovers. But anyway, so what Dr. Ohhira, this Japanese professor, found out a long time ago, and there's a story about him. I think he was in Indonesia. And one story says he got really sick, and once he was at a conference, and one story says he got drunk, but he was not doing well. And one of the shamans there gave him this black paste, and it just like picked him up. And he actually was trying to figure out what it was. He actually went and got a degree in microbiology so he could figure it out. But anyway, what Dr. Ohhira's does is take a wide variety of interesting foods and some key bacteria, and they ferment it for 3 years. Now, when you eat food, roughly it gets through your system in 72 hours, an average. And so you got 72 hours for that food to ferment and become some postbiotic metabolites. Here you have 3 years. This stuff has over 500 postbiotic metabolites in it naturally because of the fermentation. And so if your microbiome, if your rainforest down here is like a desert, you can put all the good animals in your mouth and they can get down there. Nothing much is going to happen. You've probably taken a probiotic supplement and gotten really great results and taken another one and didn't. You've probably taken it and the results faded. That's because they only really work well if they end up going through all these little barriers to make postbiotic metabolites. This is what builds your microbiome. This is what, by the way, keeps your GLP-1 system intact. John, I was looking at some stats. We eat a little less carbs than we used to, probably still too many. Okay. And we're a little more sedentary than we used to be like in the last 25 years. So, most people would say that if you have an issue with weight, it's not the only thing, but too many sweets and carbs and not enough exercise is kind of a root cause for a lot of people. But that hasn't changed very much. But obesity and diabetes are going through the roof. So there's metabolic disruption there, and it's probably different ones. But the fact that the GLP-1 drugs work, at least in terms of losing weight, shows that that's one of the key issues of the metabolic disruption. Now, I'm not a big fan of these medications. I just think they have issues with them. I can understand if somebody's really, overweight and just given up, but I wouldn't stay on them too long if I were you. It's just my opinion. But your own GLP-1 system is basically your microbiome consuming beta glucans and certain fibers to make short chain fatty acids, to make L cells, to make GLP-1, 2, and 3. And so when you look at this product, Dr. Ohhira's, that's just rich in postbiotic metabolites. So I take a lot of different probiotics. I'm sure you use different ones in your clinic. But when I look at this 3-year fermented food that they just put the whole thing in a little capsule, they don't isolate it, they don't monkey with it. It's really amazing because every biological system in your body has to operate through the microbiome. Okay. And my little image is, imagine like walking somewhere and you're walking through the beautiful woods with the sunlight and the butterflies and the hummingbirds and the trees. How nice you would feel when you get to wherever you're going. What if you had to slog through a swamp and worry about the leeches and the snakes and the quicksand? Well, if your microbiome isn't so good, then your body's operating through a swamp. Or if your microbiome's healthy, you're walking through the beautiful woods. So again, I think that whoever you are, whatever you're doing, whether you like to take as many supplements as you can afford just to hedge your bets, or you'd rather not take any, I really think plenty of vitamin D3, an omega-3 supplement, you want to consider black seed oil, and a good probiotic. There's lots of good probiotics, but I have to give the gold medal to Dr. O'Hara's probiotic.
Dave, yeah, I haven't I don't remember exactly at this moment, but I think we carry about 8 different types of probiotics, and we use them for very specific things. But Dr. O'Hara's is my baseline. If someone has, anyway, certain gut conditions, I might use one of these other formulas,
Yeah, yeah.
but O'Hara's is absolutely the gold standard. It is just astonishing. And then there's the professional grade, which has been fermented for 5 years, right?
Well, yeah, in fact,
And so
down in the lower bowel is where your anaerobic bacteria, like no oxygen, low oxygen bacteria. And so your typical green box of Dr. O'Hara is 3-year fermented. The professional is an extra 2 years of anaerobic fermentation. So this increases the postbiotic metabolites and also increases the bifidobacteria. So especially if you have those lower bowel symptoms, I'd start with a professional.
Dave, while we're talking about Dr. O'Hara, you actually introduced me to what is now my favorite supplement. Thank you. All the black seeds right up there. And that's the product that Dr. O'Hara has that also has the green propolis. Now, we've been fans of propolis around here for a while. I mean, it's a magic substance, it's what allows bees to keep their hives running. But I had not seen a product with a probiotic that also had the green propolis in it. Can you talk about that for a minute?
Well, yeah, there used to be a vitamin company. I don't think they exist anymore. They might, but they sort of educated me on propolis a little bit. I knew about propolis, not particularly expensive, and I was told it's why the bees could crawl all over each other in the hive and not get sick. It had antibacterial and antimicrobial, and I'd see it in throat sprays and immune products and toothpaste and things like that. But there's a green and a red propolis. The red propolis is extremely rare and very expensive. But the green propolis, and this is really the kind of bees and where they feed, is a treasure trove of antioxidants. I think this is accurate enough to say, but they told me that bee pollen has at least traces of every known nutrient, like, A through zinc and amino acids. But green propolis has at least traces of every known phytonutrient. So it is rich in all kinds of antioxidants. Now, you combine that with Dr. O'Hara's probiotic, which is really postbiotic metabolites, which is another just array of superfood compounds. And then they add astaxanthin, which is one of the more interesting antioxidants. It's what makes the salmon pink. And I know there's been studies on muscle strength and even, deep immune problems. So besides being one of your better immune products, because we know that nourishing your microbiome is going to help your immune system. And then you use this propolis, which you say this green propolis is just amazing in the astaxanthin. And I will tell you this, a lot of your superfood supplements are powders, so they can put a lot of good green stuff and all in it. But I know A lot of you listening don't like powders or don't like the taste or it's too gritty, it's too much trouble. I get it. But if you look at some of the same products in the capsule or tablet form, you have to take quite a bit. And I would say that the Dr. Here's Propolis Plus formula is probably your best encapsulated superfood. But I know people who rely on that for immunity. And by the way, I think cold and flu season is about 10 and a half months long now, just where we worry about viruses and things. It's not like, oh, it's November. I better take some immune stuff. Besides nourishing your microbiome, just that green propolis is truly amazing. And I think the culture of Japan has a reputation for being really precise and just focused and really great job. And I'm just finding that these products made in Japan are just really superlative. They're just done well. And whether you use the green box, the regular probiotic, the professional, or the propolis, excellent products.
I have a little personal story here. So astaxanthin, an amazing compound, right? It's like you're talking about salmon, krill oil, very rich in astaxanthin. But one of the things it does for the krill, apparently, is they swim around pretty close to the ocean surface a lot of times, and they'd get burned by the sun. It would literally burn them up. And the astaxanthin, I've read, is what protects them. Well, we went whale watching about 10 years ago, and I was doing a lot of krill oil at that time and a lot of vitamin D. So we're out doing whale watching out of Moss Landing, out in Monterey Bay, and it's really sunny. And my wife comes up to me about an hour into our trip and said, "Do you have sunscreen on? Because you can see my skin. It takes about 5 minutes for me to burn to a crisp." And it was about an hour into the trip. I said, "Oh my God, no, I don't." But you know what? I'm not even pink. I wasn't even pink. And I didn't get a sunburn. That's the only time in my life I've ever been out in the sun for a long period of time. And I got to tell you, I blame that on the astaxanthin and the high vitamin D levels.
No,
So I love astaxanthin.
I think you're absolutely right. Oh, by the way, since we just a little aside, you made me think of. I heard a very interesting thing. Someone was talking about. There's that controversy: don't go out in the sun because you can get skin cancer, but go out in the sun because vitamin D helps prevent cancer. I was told that when you go fry your skin in the sun and it becomes bad, it's the omega-6 fatty acids in the skin that are burning. So if you have a high omega-3
Yeah.
content, you are less likely, even if you get sunburn, for it to turn malignant on you. So besides the D, and you're right, the things like the astaxanthin protect the skin, protect the eyes. It's really an amazing supplement. And like I said, look, I've been in the industry a long time, and just because there's a best product doesn't mean other ones are bad. Like somebody might say, well, I've been taking this probiotic and I really love it, Dave. I get it. I've taken lots of different probiotics, and sometimes for certain symptoms, a certain probiotic will work better and faster than something else. But when you really think about what the microbiome is and how it really works, in fact, what they're really studying now in microbiome science are postbiotic metabolites. When they come up with a particular strain they like, this particular strain is so important, it's because of the postbiotic metabolite it makes, or this strain. And so I think this is one of these things where something discovered 40 years ago is cutting edge. And that's really cool when you find something that was made 40 years ago, and instead of like, oh, remember that old thing? No. So I would say if you haven't tried Dr. O'Hara's, I should mention, John, I don't know if I've mentioned this to you, but I'll mention it now. The thing that the Essential Formulas is the name of the company, is that they've come out with a sachet, a little packet with the substance, the postbiotic substance in it. Okay. And so for people that don't like pills, even though the pills are little, or the capsule materials, and it has the postbiotic metabolite equivalent of 5 professional. Because the other thing is,
Oh, wow.
I've really seen people, if they would take more than 1 or 2 a day for a little bit, really come around. But I know, say, take 3 in the morning and 3 at night. Most people look at you like, okay, they won't do it. Say, I understand. But one little sachet, by the way, it tastes good. not because they sweetened it, but it tastes like figs. So that's something we can look at. But I just think Dr. Ohhira's probiotic or their postbiotic sachet, it's just, I think it's the best microbiome food. And you can still eat a lot of good fermented foods and you can still take other products. That's fine. But please take care of your microbiome. It's one of the most critical things you can do. I saw your thing about, people say, like, I don't care how long I live as much as I want to live healthy every minute I'm here. And I think that's the real important thing. And so I would just argue, build your supplemental program around vitamin D, omega-3, and the probiotic.
Excellent. One thing that I want to throw in, which will probably make some people a little irritated, is when I'm interviewing people and I'm looking at their diet, I see a huge weighting toward chicken, right? It's the white meat. They did a brilliant job of marketing when the cholesterol studies came out. It's like, "Oh, don't eat that bad meat, eat chicken." Well, the chicken that we eat that now weighs about 8 pounds, in the late 1950s weighed a little over 2 pounds, and what they added to it is not healthy, and chicken is a very rich source of omega-6 fatty acids. So when I'm talking to people, it's like, "I see you eat a little fish and a lot of chicken. Can you reverse that? Eat a lot of fish and maybe eat chicken very occasionally, right? That's fine. But when you weight it toward the chicken, you're doing exactly what you're talking about. You're getting that omega-6 ratio way off."
My nutritionist, Sarah Keogh, I heard her do a presentation, and they had a group of people eating just like commercial chicken from the grocery store. They had people eating organic chicken fed soy and organic chicken not fed soy. And it actually went from a lot of inflammation to not so much inflammation to maybe even a little in the other direction. So, you know, I agree with you, John. We're overdoing chicken and we're not necessarily eating the best chicken. And by the way, Dr. Ross Pelton, who I've interviewed, he's a pharmacist. And he happens to be he's a brilliant guy. I really like him. And he's the science guy at Dr. Ohhira's. But I had him on the radio once and I was thinking, like, this guy's like, been around for a while. I said, Ross, can I ask you a question? What's really the best diet? Mediterranean, vegan, vegetarian, pescatarian, macrobiotic, carnivore? I just said, like, I just want your opinion. He goes, David, it's very simple for me. Eat real food. Now, back to what you brought up earlier, John, is, you know, the cow that might have been eaten 40 years ago on a farm is not the cow in Safeway. And that's where, you can't just say, like, red meat's good for you, red meat's bad for you, or
Right.
broccoli's good for you, broccoli's bad for you. It's how it's grown, it's how it's prepared, and what it's done. So the other thing is, I really think I like to say I eat a planet-based diet, not planet. And I really think that we ought to include all the foods and not exaggerate any of them. And but whatever you're eating, try to get it as clean as possible. If you have a choice, make a good one. You decide to go out to a restaurant, you hope you go out to a decent one where they have fairly good food, fairly fresh food, but you can't go in, "What oil do you use?" It's like, you just can't. You just gotta eat at the restaurant. But if you're buying water for yourself, buy a good one. If you're buying food for yourself, buy real food. And folks, you just have to realize, like, I used to say this. So, John, have you ever met anyone right around in your age group and they were just doing really, really well, and, you're sort of jealous of them? Like, "Wow, I can't believe they're my
Oh,
age."
I've got some that are 20 years older than I am that are coming in, and you wouldn't believe it. They run circles around a lot of 40-year-olds.
Yeah, now and that's because they're on better medications than you? No.
Not at all. The one patient I'm thinking of is on no medications.
Well, exactly. And so my point is, when you see people that you go like, "Wow, he's 70 as well as I am, and look, boy, he's really fit. He's this, he's that." It's because maybe he's exercising more than I am, eating better than I am, and maybe not taking medication. So we're getting healthy because of diet, lifestyle, nutrition. We're not getting healthy because we're on the right drugs. And the other thing, I made the statement at the beginning of this podcast that we may be confusing being medicated with being healthy. The other thing I want you all to know is we can manipulate risk numbers so that you look a lot healthier than you are. Okay. I mean, we can take a statin and interfere with liver function and drop the cholesterol. I can't figure out if we did anything for your heart or your vascular system. So, we can say, well, John used to have 250 cholesterol and now he has 170. He's much healthier. Is he? No. If he's cardiovascular healthy, it's because he exercises, he gets circulation, he eats right, he doesn't smoke. It's those things. So please, everybody, if you want to age well, and my thing is, so far, I don't think I can live forever. So I figure I'll check out someday. I just want to go out on my feet. I want to be there. I want to be happy and healthy. So folks, you got to use Mother Nature. You got to really if you don't always be trying to up your food content. Think of the little things you can do to be healthier. Park far away and walk. There's little things you can do. If you're disciplined enough to go to the gym and get serious, God bless you. And then avail yourself of Mother Nature's medicine chest. And yes, let me say this, John. I love the internet. One time I needed a video camera. I ordered it in the evening from Amazon, got it in the morning. I was like, it's amazing. I don't buy things on the internet I'm going to eat unless I really know where they came from. If I order from you on the internet, I'm fine. Okay. But I don't just order stuff on the internet because I'm a little nervous about it. You only need something bad. In health food stores, you really have to jump through a lot of hoops. So I'm a big believer in find a good health food store or a clinic that has the supplements you need. They're reliable, and deal with somebody that you can talk to. Now, there are legitimate internet places, but look into them. Don't just buy stuff like that, and find places. If you're in California, go to a farm, buy some stuff from a farmer. Ask the farmer what they do. Go to farmers market. Just try to up your lifestyle little by little, reduce your plastic. There's so many things you can do, but that's going to keep you. You're going to be one of those 20-year older than John running rings around him. Okay. That's what you want to be, but I really think that you have to be careful about medications. They wear you down. John, I guess we'll wrap up here, but one time I gave a talk to a women's group in San Mateo, and there was a woman, I believe she was Chinese, and she had broken English, but I'm going to say what she said just like she said it to me because the way she said it really made an impact. Okay. She came up to me and says, people come to me, think they sick. They not sick. They on drugs. And from that point, I started asking people, my joints are hurting. Are you on a statin drug? Yeah. Are you on a bone drug? And I started realizing that a significant amount of some of the symptoms the older customers had may well have been either caused by or exacerbated by the medication they were on. But no one looked at that because a lot of these adverse effects happen down the road. You take a cholesterol drug, you feel fine, your number goes down, you're happy. And then in a couple years, your memory fades a little bit. So anyway, I'm just like, folks, you've got great health food stores. You've got practitioners like my good friend here, Dr. John Nieders, that you can talk to. I think you do telemedicine too.
I do telemedicine, and Dave, a lot of times people don't know where to start. Do I go to an MD? Do I go to a podiatrist, a chiropractor? Do I get voodoo? And so I do free 15-minute discovery calls every week. I have, some slots every week, and people can just pick my brain for 15 minutes. And I love it. It kind of takes me back to my radio days when I would just field calls from all over the world. You never know what's going to come in. And I remember one guy used to try to play Stump the Acupuncturist. I'm sure he studied all week to try to find something to ask me. But I love that. I just love being on the spot like that. So I usually have 4 to 6 of those discovery calls. They're free, and I have those every week. And so kind of just being a resource to help people go in the right direction.
Well, yeah, and look, there's I know people all over the country, but I've known John for a long time, and I take my family to John, and we love him. He's I don't want to embarrass you, John, but he's a kind person. He's a thoughtful person, and he's very knowledgeable. And I like his spirit. I'm not sure. I'm sure he gets rattled sometimes, but I've never seen it. And I think you want somebody that with a big heart that's calmly looking at you and helping you along the path. And by the way, don't wait for a crisis to try to find a natural person to help you. Get a relationship with one. Maybe you're fine right now. Maybe you want to get to know John or somebody and just let them evaluate you and give you some tips. And then if something does come up, you've already got somebody you know and trust. And so like my friend said this person. So folks, please, my message is, you know, again, clean up your lifestyle a little bit. You don't have to be a saint, but clean it up, eat better food, and avail yourself of some of the wonderful uh, things of Mother Nature's medicine chest. And this is what's going to, I'm not in perfect health, but I'm 71. I don't wear glasses. I don't have joint pain. I'm not on any medications. Um, don't have great teeth, but I'm not perfect. But I think I had bad habits when I was a kid. I smoked for like 35 years. Okay. So, I stopped drinking alcohol a couple years ago just because I I was very functional, just drinking home. But, I said, okay, at my age, can't get away with that. So wake up everybody and enjoy yourself. And um, I think medication should be mostly for crises. And, if you're on medication, don't throw them away, but, turn your direction in diet, lifestyle, nutrition, and that will serve you well.
Well, Dave, A, you did succeed in embarrassing me, so thank you. Those were very kind words.
Anytime, John.
And B, I really wanna thank you. The more we can simplify, right, and kind of boil things down to their essence, there's too much noise out there. It's everything. We're surrounded by noise in one form or another, and I think the more we can simplify, the healthier we're gonna be. And so I wanna thank you for doing this and bringing this cohesive group of supplements to introduce to people. So thank you.
All right, John, it was a pleasure, and hopefully we'll do this again sometime.
Thank you for joining me on The Balancing Point. If you enjoyed today's episode, please follow the show, share it with a friend, and leave a review. Feeling out of balance? Most approaches just manage symptoms. Here, we get to the root. So real healing, real clarity, and balance can begin. Visit AlamedaAcupuncture.com. That's AlamedaAcupuncture.com to learn more, explore our supplements, or book a call. We'd love to hear from you.